Welcome to this iHealth Global webinar. I'm Melissa Chen, and it's my pleasure to be your host today. Before we get started, I have some housekeeping announcements. This meeting will be recorded. By attending to this meeting, you agree that you are part of the recording. Please mute yourself when you are not presenting or ask questions. And please hold your questions until after the presentations. You may use chat to submit your questions. Now allow me to introduce myself. My name is Melissa Chen. I joined iHealth last August, and I'm currently a member of the Global Distributor Committee. I have been the host of our weekly webinar since last October. Before I joined iHealth, I was a life insurance agent and real estate agent for 18 years. I find my experience at iHealth both inspirational and rewarding. Here is our agenda today. First, I will introduce our speaker, Dr. Zhang, and Dr. Zhang will give us a brief overview of NMN's health benefits. And then I will introduce our special guest, Mr. Donald Ward, and ask him to give us some advice on how to grow our business in iHealth. At the end, we will reserve some time for Q&A session. Today, we are delighted to have Dr. Zhang here with us. Dr. Zhang graduated from Beijing Medical University and holds a PhD degree in biochemistry from Texas Christian University. He spent his early career at National Institute of Health as a research scientist. He then spent over 16 years in a senior management position at the American Society of Clinical Oncology. Currently, he is a senior consultant to the National Cancer Institute. Dr. Zhang is also a member of iHealth's Global Distributor Committee and is responsible for iHealth's product chain. The title of his talk today is A Brief History of NMN Health Benefits. Dr. Zhang, the mic is yours. Thank you.
Thank you, Melissa, for a very nice introduction. Hello, friends. I'm Dr. Alan Zhang, and I'm so glad to be with you here virtually. I want to thank you for spending valuable weekend hours with us. I'm also very excited to have Dr. Donald Ward here with us, and I'm looking forward to hearing his insightful advice on how to grow our business. We really hope you can enjoy and benefit from this webinar. Last time, we discussed the history of NMN discovery. I think people probably more interested in the NMN functions and its health benefits. So today, I'd like to have a brief discussion about NMN's health benefits. Due to the time limitation, we won't be able to cover all the details. I hope in the future, we can address some specific health benefits in greater details. For this discussion, I'd like to group the NMN benefits in the following categories. The first category is about health benefits supported by clinical evidence and human trials. These benefits are more convincing and more acceptable by the public. The second category is about potential benefit supported by animal studies and consumer feedback. The majority of NMN's benefit we are going to talk about today belong to this group. There are a lot of animal studies and consumer feedback, but currently no human clinical trial evidence. I'd also like to discuss briefly about NAD in cancer research, since this is a very hot topic. And lastly, I'd like to conclude this presentation by discussing the mechanisms behind NMN's function. So before we start, just a quick disclaimer. iHealth products are dietary supplement. We cannot claim they can diagnose, prevent, or treat any disease. This presentation reflects my personal views only, and the discussion here is not intended for medical advice. So first, let's take a look at those benefits supported by clinical trials. And in US and in many other countries, in order for a drug to obtain regulatory approval for market, it has to go through several studies. The preclinical study is the animal study that proves the drug's safety and effectiveness in experimental animal models. Human phase 1 trial is the safety study where the drug is given to a small group of people. The purpose is to test if the drug is safe in humans. Human phase 2 and phase 3 trials are usually randomized, placebo-controlled, double-blind studies to further prove the drug is safe and effective. There is a special type of clinical study, clinical case report, where doctors publish their case studies on experimental treatment in professional journals. These are valuable literatures and often shed light on some novel treatment. Also important is the consumer-reported outcome, like our users' feedback and those witness videos. These reported outcomes can be an integral part of healthcare big data and used as reference by healthcare professionals. So the quality of these consumer-reported outcomes is critical. In early 2020, a human safety study was reported by a Japanese group. It was a phase 1 trial. A small group of 10 Japanese men participated. One-time oral consumption of NMN, 100 milligram up to 500 milligram per day, was given to this group. No major side effects or discomfort were observed, suggesting NMN is likely to be safe for humans. Later, human clinical trials on NMN also showed that long-term consumption of NMN is safe. So the first human trials on NMN health benefit was reported this year in April by scientists from Washington University. This human clinical trial shows that NMN improves metabolism in aged women with prediabetes. Specifically, this showed that NMN increases blood cell NAD level and improves muscle insulin sensitivities and structures in aged prediabetic women. It also showed NMN increases gene activities for muscle remodeling. This clinical study is the first to report the effectiveness of NMN on human health and is one step toward the development of anti-aging intervention. Another human clinical trial study reported by a Japanese team from the University of Tokyo showed that NMN could improve muscle motility in old men. This was a randomized, placebo-controlled, double-blind study. This result is significant for older people because older people tend to have weak muscle, which in turn causes a lot of health issues and risks. For example, falls and bone fractures. The next NMN benefit is widely reported. NMN accelerates the recovery from COVID-19 infection. I'd like to share these YouTube video clips with you. This is Dr. Sinclair from Harvard University, interviewed by Family Office Association in April 2020. During the interview, we can hear that Dr. Sinclair mentioned that NMN was used by some hospitals to fight COVID-19. So I'm going to start this video.
Just on a call this morning, actually the past 2 weeks, I've been a lot of calls with hospitals who are trying NMN actually for COVID-19 patients, which we'll get to later. The problem is that certainly in mice, and it looks like in people too, many of our tissues, and certainly our skin, we have less NAD as we get older. And that means our sirtuin defenses, which are cleaning up cells and preventing the scratches on our genome, they work less. And particularly with COVID-19 patients, it's been shown in early work that they have very low NAD levels as well once they have the infection. In fact, the virus chews up the NAD. So what we're talking about is restoring the NAD levels back to a youthful level and allowing our bodies to defend themselves and heal the way we did when we were young.
Is there any clinical evidence to show that NMN actually worked in COVID-19 patients? The answer is yes. In September 2020, a clinical case study was reported by Dr. Robert Huizenga from Cedars-Sinai Medical Center in Los Angeles. Dr. Huizenga released a study where he used NMN cocktail to treat older patients with COVID-19 infections and found that rapid and dramatic improvements in clinical parameters with this treatment. Notably, the patient had decreased inflammation markers and increased white blood cell counts in their blood after receiving the NMN cocktail. The cocktail includes NMN, betaine, sodium chloride, and zinc. Betaine is a molecule extracted from sugar beets and can help NMN absorption. I'd like to mention that we have received several witness videos from our consumers that also showed NMN significantly shortened the recovery from COVID-19 infection and reduced symptoms of the disease. So this study is related to the NMN cocktail treatment. In February 2021, earlier this year, phase 2 and phase 3 clinical trials were reported by a group of scientists from Sweden, England, Turkey, and China. The study showed that a mixture of combined metabolic activators consisting of glutathione and NAD precursor, NR, nicotinamide riboside, can restore metabolic functions and aid recovery of COVID-19 patients. The recovery time was shortened by 30 to 40%. Although in this study, NR was used instead of NMN, but we know that NR is the precursor of NMN in the cell. NR is first converted into NMN and then turns into NAD. So NR is almost equivalent to NMN. The bottom line is this: NAD plus booster can be used to speed up the recovery from COVID-19 infection. So we just talked about the NMN benefits that are supported by human trials. Now let's take a look at the second category, the benefits that are supported by animal studies and complemented by consumer feedback. These studies are still preclinical, meaning lack of human trials. Although some have great potential to be applied to clinical settings in the future, they are not currently recommended by doctors. These benefits are widespread across many systems and tissues. Here is just a short list. So in animal studies, NMN can reduce inflammation, acute inflammation or chronic inflammation. It can also reduce autoimmune response. That is the immune system attacking itself, the self-feed tissues. So reduce autoimmune response. And NMN can also improve metabolism and mitochondrial functions. It can promote cell differentiation and tissue regeneration. It can repair DNA and stabilize genome. Also improve the immunity and regulate the circadian clock. In many animal studies, NMN has been shown to increase cellular NAD level and have many therapeutic effects on human diseases, including diabetes, obesity, ischemia, reperfusion injury, heart failures, vascular dysfunction, intracerebral hemorrhage, Alzheimer's disease, retinal degeneration, acute kidney injuries, and liver diseases. So I'm going to highlight just a few in a minute. So first, NMN and cardiovascular systems. So statistics shows over 6 million people in the United States have heart failure every year. And heart failure contributed to 1 in 8 deaths in 2017. The condition cost the nation an estimated $30 billion a year. In 2017, scientists from the Duke University found that boosting NAD level by NMN improves heart functions in mice with heart failure. NMN was also shown to reverse vascular dysfunction in aging mice. In 2016, research from University of Colorado shows that aged mice that drank water with NMN had improved artery functions, critical to preventing cardiovascular disease. NMN protects the mouse heart from ischemia and reperfusion injury. Ischemia and reperfusion injury can lead to life-threatening conditions such as heart attack or stroke. In 2016, scientists found that NMN can protect heart injury in mice by increasing NAD level. Now, NMN and the central nervous system. First study, NAD plus alleviated symptoms of Alzheimer's disease in mice. So in 2019, research on Alzheimer's disease from the Shanghai Geriatric Institute of Chinese Medicine and the Shanghai University of Traditional Chinese Medicine identified NMN synthesis as a principal step in this disease progression. Increasing NAD could improve the symptoms of Alzheimer's disease. Next, intracerebral hemorrhage is an emergency condition in which a ruptured blood vessel causes bleeding inside the brain. This can cause stroke, disability, and even death. In 2020, a research team from Shanghai Jiao Tong University showed that injection of NMN could effectively improve the damage of intracerebral hemorrhage in mice brain and improve the survival of the mice. Stroke is a leading cause of mortality and disability. In 2020, researchers shown that NMN could delay stroke in mice fed with high salt diet. Scientists also find that NMN improves the depression-like behavior and increases cellular energy production in mice. These are all important findings of NMN in the central nervous system. So next, I'd like to talk about NMN and reproductive system. So last year, a group of scientists from the Chinese Academy of Science published an article in Aging Cell comparing the quality of oocytes in young and elder women, female patients. Their research shows that aged women had more mitochondrial DNA mutations in oocyte and a lower rate of forming blastocytes, a key step for embryo development. Importantly, these mitochondrial DNA mutations were linked to decrease in female mice fertility by reducing ovarian function. So what happens is that the mitochondrial DNA mutations might stop the DNA NAD level, which cause the decline in mitochondrial functions. And lower the mitochondrial function is associated with infertility. The good news is that the decline of NAD can be rectified by NMN, at least in the animal studies. This research suggested that NMN may be used to prevent oocyte aging and to promote fertility in older women. Similarly, similar things happen to male sperm as well, although to a lesser degree. With aging, we have lower NAD level and more mitochondrial DNA mutations, which lead to infertility. NMN may reverse or slow down this process by boosting the NAD level. Let's take a look at some other studies on NMN in the reproductive system. So in 2020, a study from the Harvard University and the University of New South Wales in Australia found that declining NAD is associated with oocyte dysfunction during reproductive aging, and oocyte quality and fertility can be restored by NMN in aged mice. Furthermore, supplementation of embryo media with NMN improves several developmental milestones. Another study shows that NMN could restore the fertilization ability of oocyte exposed to environmental pollutants. The common solvent ethylene glycol butyl ether, EGBE, is toxic to reproductive system. Exposure to this toxin can result in reproductive problems, including testicular damage, reduced female fertility, death of embryos, and even birth defect. Studies show that EGBE causes mitochondrial dysfunction, increased free radicals, DNA damage, and eventually the death of the cells. NMN protects oocyte quality from EGBE-induced deteriorations. It was suggested that NMN supplementation can be an effective strategy to protect oocyte against environmental pollutants and improve the animal and human fertility. So let's take a look at the NMN and other organ health. So let's talk about liver. In a 2019 study, researchers described how NMN can be used to treat liver diseases caused by alcohol consumption in mice. And we know that chronic alcohol consumption contributed greatly to liver diseases worldwide. ALT and AST are liver enzymes that are released to the blood when liver is damaged. It is a biomarker, an indicator of liver damage. In these figures, the left two columns are control and the right two columns are NMN treatment. So we can see that in both cases, ethanol consumption caused significant increase in the liver enzyme, indicating liver damage. And NMN reversed the damage from alcohol. So we can see that ALT and AST, both enzymes are restored to normal level or almost normal level after NMN treatment. Another study also showed that NMN inhibits the onset of liver fibrosis. When our liver gets injured, whether from chronic alcohol consumption or the buildup of cellular stress, it can cause scarring, known as fibrosis. This excessive scarring can lead to diseases like liver cancer and cirrhosis. But currently, there's no good method to prevent it. A research team from Tsinghua University in Beijing found that NMN supplementation could prevent liver fibrosis. They found that first, reduced NAD level is linked to liver diseases and injuries, and NMN could suppress certain genes activity linked to liver fibrosis. Thus, NMN is suggested to be protective for liver diseases. NMN has many other benefits. For example, NMN has been shown in animal studies to prevent kidney damage after acute kidney injury, to protect age-related eye damage, to reduce inflammation and autoimmune diseases like rheumatoid arthritis, psoriasis, multiple sclerosis. NMN was also shown to improve the bone formation and prevent osteoporosis. So because of the time limitation, I won't be able to go through the details today. I plan to have a deeper discussion on some of these conditions in the future webinar. Although these studies were mostly done in animals, they are very promising. The challenge with these diseases is that there is simply no satisfactory treatment or prevention right now. NAD boosters like NMN may offer an alternative to the current intervention, or filling the gap where there's no other options. This is why NMN is so promising and people really get excited about its potential. Last but not least, I'd like to talk about NMN and cancer. So this is probably the topic that people are most interested in. Will NMN prevent cancer? Will NMN cause cancer? Can I take NMN if I have cancer? But unfortunately, this is also the area that has most debate and very few answers. So what do we know now about NMN in cancer research? So first, in several animal studies, NMN was shown to lower the chance of cancer, probably due to its downstream effect on DNA repair and genome stabilization, and the effect on reducing oxidative stress and chronic inflammation. So if you don't have cancer, NMN may help to reduce your chance of getting cancer. There are also studies to show that NMN can help reduce the side effects of cancer therapies, chemotherapy or radiation. NMN can reduce the inflammation caused by chemo or radiation therapy. It can promote cell repair and improve the mitochondrial function to provide more energy. All this helps cancer patients to reduce their discomfort as a result of therapy and regain the strength. We actually have quite a few feedback or witness videos from our cancer patients to show that NMN helps them control the side effect of chemotherapy and improved their overall quality of life. So what about if one already has cancer and is in the middle of cancer treatment? Well, this is what we know so far. Some studies show that in certain type of cancers, the level of NAD and the enzyme that makes NAD is elevated. The immediate concern is that will taking NMN, which will boost NAD level, promote cancer, fuel cancer cell growth? Will NMN interfere with the therapy? So I want to emphasize that right now, there's no evidence that NMN will cause cancer. It is unknown whether high level of NAD will help cancer cell to grow, or it is a response to the cancer growth. I personally think it is probably a response to cancer growth, meaning cancer happens first, then the NAD level increases as a result of the cancer. So knowing this, what should we do? My suggestion is that if you already have cancer and is currently in the treatment, consult your doctor before taking NMN. As a matter of fact, for any disease, including if you are pregnant, consult your doctors before taking NMN. Even though the NMN has been shown to be safe in healthy adults, there are just so many unknowns. So by now, you may ask, how come NMN has so many health benefits? It all comes down to this single molecule, NAD. So NAD plays a central role in many cellular processes. It is like a master key that opens so many doors to various metabolic pathways. This diagram illustrates NAD functions. It participates in many biochemical reactions in our body, including those that produce energy. The ratio of NAD and its reduced form, NADH, is a signal, and it is involved in many signal transduction in the cell, modulating various processes. NAD also participates in DNA repair. It is the substrate of DNA repair enzyme called PARP. And we all know that NAD is a cofactor of longevity protein sirtuin. And through sirtuin, it exerts its anti-aging effect and helps prevent or improve many age-related problems. Unfortunately, NAD level declines with age. In addition, some health problems like chronic inflammation, virus infection, or even cancer could further deplete NAD, making its level even lower. And this vicious circle continues. So NAD deficiency is the root cause of so many health problems. And that is also why we need supplement like NMN. NMN is the most direct and effective way to boost NAD level. The sole purpose of NMN is to increase NAD level in our body. So the reason NMN has such a wide effect is because it's working on the root cause, the upstream of many pathways. Instead of focusing on one or two problems, NMN makes our body more efficient to behave like normal and young. I'd like to end my talk by saying thank you for your time and interest, and I'm looking forward to seeing you in our next session. With that, I'm going to turn this over to our host, Melissa. Thank you, everyone. Hello, Melissa. You may be on mute.
Can you hear me?
Yes.
Okay. Thank you so much, Dr. Zhang, for this wonderful presentation today. From your presentation, and we learned a lot about the NMN, like a brief. Please mute yourself if you don't need to make a speech right now. Thank you so much for your cooperation. All right. For this brief overview of NMN's health benefits, we are really learned a lot from you. Thank you so much. And I'm sure people would have questions, but we are going to, okay. We are going to hold the questions until the end, okay? And right now, I'm honored to introduce our next speaker, Mr. Donald Ward. Mr. Donald Ward is a senior member of iHealth's executive management team. He is an experienced business owner and entrepreneur who started his first company in 1977. With his decades of business experience, he has advised many, many companies over the years. Mr. Ward now brings his wealth of knowledge and experience to the iHealth management team with the goal of helping others achieve better health, improve human longevity, and financial freedom. Mr. Ward has given many talks on iHealth business and shared his own experience. Today, he is going to provide some valuable advice on how to grow our business in iHealth. I'd like to put up the first question to get the conversation started. And someone asked, okay, someone will ask you, is network marketing only for the extroverts? If I don't have a lot of connections, can I be successful? What's your recommendations? Sorry, Mr. Ward, I have 3 questions for you now.
Oh, that's fine. As far as being an extrovert, sometimes that's good and sometimes it's not so good because we can sometimes overtalk. That's something that I do sometimes. I feel I say too many things, but at the same time, it doesn't hurt to be an extrovert, but you don't have to be to start this business. You don't have to be, you don't have to have a lot of connections to start this business. And I want to emphasize to a lot of people that I think one reason why they drew me to the executive management team is because I started as someone who was working and then came into this business doing that. So I had my work that I was doing, plus I was basically doing these types of businesses as part-time. So that's really what that question is about. I didn't have the connections in that sense that a lot of people do as well. I had to make my own connections. So if we are finding ourselves in that position, it's best for us to just talk to anybody and everybody. we each have our own stories. We have our own things to talk about, how the NMN has helped us. We have other products that I'm sure we've been using that we can talk about as well. So we learn to speak to anybody and everybody. If we're at the store, maybe taking a walk in the park. We have our immediate circle of people. That would be our family, our friends, maybe coworkers. Sometimes it's not as easy to talk to them as you may think, but it's easier to be in the grocery store line and talk to somebody right there. I don't know how many times I've been at the park and someone walks by and I say, hey, have you ever heard of NMN? NMN, well, what's that? There's an opening right there. You have a chance to talk to somebody. I never met this person before, but I have something to talk about. Always have something with you that you can share with them, and take it with them. If you have, for instance, some capsules, take a capsule and then give them a capsule. Don't give them first a capsule because they may not know what it is, but if they see you take it, then they're more apt to maybe take it as well. So we can build our own connections. And sometimes it's hard. I've had so many people that are very shy, and they say, "Oh, I can't talk to this person. Oh, I can't say that. I can't say this. I can't say that." But you know, eventually, the more you do it, the easier it becomes. And I've known many people that were introverts that are now extroverts because they have learned how to get around some of those things, and they've become so successful. You can't even believe they're the same person. So it's a wonderful experience when that happens. And for me, I guess I've never had that problem. From a child on up, I was always, the first one to talk. So that part's not a problem. It's just helping others who have difficulties. Had a good person today at the office. He was trying to support his wife in this business. She speaks Chinese, he speaks English. So he wanted to know, how can I help? So I gave him some advice to set up a little group. If she has some English speaking people or what have you for her little group, then put them in that group, and then he can help her by explaining things to them about the product. And eventually they'll grow pretty big because they can work as a team. And then, of course, we have our English meetings that they can listen to and learn from. And eventually they may be one of your guest speakers here as well. So who knows? They might be telling people what they did to start their business as well. So there's so many ways we can do this.
That's good. Then what's your recommendations? Any more recommendations for us?
Well, as far as my recommendations, as I said, become a people person.
Okay.
Look for people you want to do the business with. If you just, if you get somebody that is, let's say, somebody you really don't want to work with, it's going to be a thorn in your side. So we need to speak to people that we're comfortable with. Oh, here's another recommendation too. Look for people that are extroverts.
Okay.
Okay. So when you're building your team, you look for the ones who are that extrovert that you can work with to maybe talk to people that you're a little shy to talk with. So that's another thing that I've done as well. I tried to find people in my groups that can do the things that I either don't have time for, or sometimes maybe not patience for, because we all have different levels of sensitivity. We all have different levels of comfortness. So if you find those people that can do that with you and be that part of your team, then that will also get you above and beyond some of those things that hold you back when it comes to extrovert, introvert, or what have you. So that's another recommendation that I give out there to a lot of people.
That's good. That's good.
Yeah.
Thank you. Thank you so much. And I see some questions in the chat section. All right. Somebody asked, is there a long-term effect of taking NMN? What is the longest duration human has taken NMN?
Well, I would have to say, oh, go ahead.
Go ahead, please.
Well, I would have to say that we have a lot of evidence, first of all, from Dr. Sinclair. I know his videos and his experiences were some of the first ones that were shared with me and many other people when it came to talking about NMN. But NMN has been around for a long, long time. They just weren't able to fully put together all the benefits that NMN have been able to do for humans. For myself, I've been taking this now for 2 years, and I keep feeling better and better every day. So for myself, you cannot tell me anything different than the fact that NMN is very beneficial for our bodies. And then sometimes I find myself taking a little bit of extra NMN depending on what I'm doing. If I'm doing something extra like exercising, riding my bike, or doing something to that effect, or maybe I know I have a very heavy, stressful day ahead of me, I may take some extra NMN to help get through those portions of the day that would stress me out. We have not just our regular normal stress, but we have the oxidative stress that comes along with extra work, extra pressure that's been put on us for the day. So all of those things are what our NAD levels, NAD plus levels can help to get through. Say muscle recovery, nerve recovery, every aspect of the things our body goes through, NAD actually helps the system. So if we can keep that boosted up, we'll go further and do it in a much better and more efficient way.
Okay, that's good. Thank you. Dr. Zhang, would you like to give some more suggestions?
Yes, sure. So, from the literature, looks like the human trials, the longest trial, is about 12 weeks, so approximately 3 months. That's the longest trial that's published. But I agree with Donna that NMN has been around for a long time, and apparently Dr. Sinclair started taking this, I think by now, it's probably years and years. And the molecule is very safe. And as Don just mentioned, I sometimes take extra. Actually, I took a NMN right before this talk, because I feel like it gave me some energy and relax me a little bit, maybe. So I do that before the talks. So
great, thank you so much. And I don't see any other questions in the chat session. Okay, so if you do have some questions, so you can raise your hand, or you can just put your questions in the chat session. Okay, so we can ask either Dr. Zhang or Mr. Ward. So Donald, may I ask you another questions? All
Sure.
right. Okay, what's your advice for those who don't have any business experience? I mean, like for those who already have worked for someone else?
Well, as I said, I believe that's one of the reasons that I was asked to come into this company, because that's how I started in MLM. Is I was doing it part-time. I would only do it a couple of hours a week, but then you start getting more people in and you're able to spend more time and more time and more time. And then it becomes a more permanent aspect of your life to where that is all you're doing. So my experience comes to the point of, where do you want to be with your MLM company? Do you want just extra income? Do you want it to be a full-time business? So I've always seen that people that get that first commission check, and yes, I did receive checks. Now we have mass pay, so it's all electronic, but it's still there.
Mhm.
So I would tell them, if you, and I'm just going to throw a number out there, if you make your first $250 check and you're excited, just remember you can double that. And then once you double that, then you can double that. And before you know it, you're at that time, we were opening up our mailboxes and finding a $4,000 check, a $5,000 check, and then $6,000 check, and it just kept going up and up and up and up. And so those figures are real. Now, it doesn't mean that it happens all on its own. You do have to work at getting it, but I can guarantee you, if you can get your first check or your first commission, you will continue getting commission, and especially through iHealth. iHealth is the only company that allows you to do it with one line of people, period. I can't emphasize that anymore. I've been through so many of these MLM companies where you have to have a minimum of 2. And if one person drops out of one of those other lines, then you lose your commission. You lose everything, because you now no longer have that second leg, as they call it. But with iHealth, once you get somebody in and they get on auto ship, I can't emphasize auto ship enough. It's very simple. People freak out over auto ship, but there's no reason to. Auto ship takes that burden off your brain. That reduces your oxidative stress for thinking that day, because it automatically gives you your products at the end of the month. With our auto ship, we also get a website. So we can use that website to send people to. We have our back office. We have all those different benefits with our auto ship. And so use it. Teach people to do that. That is the best way to build a business, even with 1 or 2 people. And believe me, 1 or 2 people will start getting you a little bit here, and it kind of gets you excited. Now these are for ones who don't have a lot of connections. These are for ones who think, oh, I could never do it. I believe in my last PowerPoint that I did, the meeting, I explained to people where I was getting phone calls and said, what's this number 4 by my name now in my back office?
Mhm.
And I said, well, that's because you now have boosted yourself. You've gone up now to a level 4. A level 4, once you hit that, there's no turning back. You're now a full-time partner. And they did that because they were inviting people in just at level 2s.
Mhm.
So my goodness, it's such a unique way to build a business. You don't have to have business experience to do that.
Mhm.
And you can do it also while you're working. So it's very simple. In fact, I have so many people that I started in this business that have full-time jobs because they still have to pay their bills. So they work full-time, and now a lot of them are working just part-time. And eventually they'll be working full-time for iHealth, because that's the future. That's what I wanted for myself. I wanted to make sure that my future is secure with a residual income. we're not just building a business here, we're building a residual business. That's if anyone is familiar with celebrities and music, they have residual income from the things that they've done for many years back. So they get commissions from that for life. So it's up to them how they spend it, but they're still getting it. So
Okay.
good experience, good question.
Okay. I couldn't agree with you anymore.
Yeah.
Wow,
Okay.
that's really good. Yeah. But I see another questions in the chat session. Professor Jim, does NMN work like a steroid? I was asked, is NMN steroid just a different name, but is NMN steroid? Do I pronounce right?
Yeah, you said that right.
Okay, nice. Dr. Zhang, could you answer this question, please?
So NMN is not steroid. I can't remember where I mentioned that word steroid, but NMN is not. NMN is a vitamin B derivative. So it looks like vitamin B3, but it has a extra phosphate on the molecule. So we can call it a vitamin B3 derivative, but it's not a hormone, not a steroid.
Okay, so there is another question here. So Dr. Zhang, can you elaborate more on cancer subject? Do I hear it right that NMN do cause cancer cells?
No. So there's what I said is that there's no evidence that NMN will cause cancer. There's no evidence. So the observation is that for certain cancer, NMN, not NMN, NAD level is higher than normal cells. That's the observation. So right now, nobody knows for sure whether it's, the higher level of NAD is the result of the cancer or that is causing cancer. So if you don't have cancer, you don't have to worry about it. And there's no evidence that NMN will cause cancer. And on the contrary, in many animal studies, NMN actually lowers the risk of cancer, right? And for cancer patient who is taking, the active treatment, that's when we want to be careful. That's when we want to discuss with our doctors, right? Because there's no evidence that NMN will make it worse. We don't have direct evidence NMN will make the cancer go away, but we do have evidence that NMN will help with the side effect of chemotherapy. So it's a tricky area. So that's why we suggest that the patient talk to their doctors before taking NMN.
Okay.
So I hope I address your question, but unfortunately in this area, there's no clear answer. There's no clear answer in this area, unfortunately.
Okay, thank you. There is another person asked about Donald, Dr. Zhang. Some are interested to take NMN, but they want to refer to their doctor. But doctor never heard about NMN. So how to go about this? Very common question here.
Yeah. For me, I agree. Most doctors have not heard about it because they are mainly into prescribing drugs and other things that they feel are more apt to help a person's symptoms or situation. The best reference that we have, of course, is the PDR. It used to be called the physician's desk reference, but now it's the physician's digital reference. We used to be at one time the only NMN product that was listed in the PDR, but now others have also acquired that status. So more and more evidence is being presented to the medical community, allowing the door to open up for NMN to be in front of the doctors. So they do have information available in their PDR. And that is something that they really should study. For me personally, if my doctor will not listen or will not study about something they've never heard of before, then I don't want them as my doctor. I'm sorry, but that's how I feel. That's my personal opinion. Because I've run an automotive business for many years. And if I said to myself, I'm only going to work on 1976 vehicles and no more because I don't like it from there, I would have been out of business many years ago. So I had to stay up to date with all the latest information, with the computer systems, and all the different things to make sure I can handle my customers' needs throughout these years of running my businesses. So it's the same way with the NMN or a doctor. A doctor should be able to say, yes, I am willing to learn new things because it's very important to make sure my patients have access to the best possible treatments available. I do know some doctors that will not treat you until they have tested you for vitamin deficiencies and other things such as that, because it could be just that is causing your issue. So those are the type of doctors I like to see. So refer to, and don't be afraid to refer to the PDR with your doctor. Make sure they understand that you're not just a patient, but that you have a little bit of knowledge about something. And if they still want to hesitate, then be a little forceful. You're the patient. You can have them look into something, or you can look into some of the evidences yourself. If you have a certain issue, go to Google, put in your issue and NMN, and whatever research you get back from that, you can take that also to your doctor. They don't have to be blind to the fact that NMN is a real supplement that can help many, many people. They do understand a lot about the immune system. So when we talk about NMN boosting the immune system, maybe doctors don't know that. So, doctor doesn't know everything. No offense, Alan. I'm just.
Well, I'm not a medical doctor. I certainly wouldn't
I
take it
know.
as a defense.
I know.
I
know.
think
I'm just.
you made a very good point by recommending the the physician reference. I think that's has a lot of convincing power, and I also think that there's an opportunity for educating our doctors.
Yes.
Because this is something so new. NMN is quite new, and some of the doctors may not been kept up to date. So there's an opportunity to educate them as well.
One other thing, remember, we have doctors that are actually medical doctors in iHealth. Now they're not in iHealth as medical doctors. They are just medical doctors who have come into iHealth, and they are very happy to recommend NMN to their customer or their patients, because they know the benefits that they're receiving from it. And they're very intelligent when it comes to that, because we have so many unknowns out there. I don't like to take medicine myself if I don't have to. So I would rather be on a natural supplement such as NMN, which is all I take, by the way. And rather than being put on some sort of medicine that's going to damage my liver or my kidneys or other parts of my body. And, I've just seen so many things of that. My mother was a good example. I called her a walking pharmacy, and because she just had so many things. Then the side effects, medicines for the side effects, and all these different things that just it's made it a horrible existence for her when she was alive. She was diabetic. Every aspect of diabetic disease you could think of, she had it. So it was horrible, so don't be afraid to educate your doctor. That was a good word. I don't think I used that, but teach them. You know, they can learn things too.
Mhm. Yes, thank you so much. And I do see another long questions in the chat.
Yeah.
From Susan, right? So Susan, would you like to open your mic and just like long word in short and talk about a little bit? Or Dr. Zhang, can you read these questions and see how
Yeah,
you
so
answer them?
I think that's a comment. There are some studies to show that NAD might be pro inflammatory inflammation. You know, NAD may contribute to the increased inflammation. So that is their study. So how do I see this conflicting study? So I mean, metabolism or the reactions, chemical reactions in our body is very complex. There's thousands, if not, you know, hundreds of thousands reactions, right? So when we look at this, all the, you know, reactions, which one cause which, you know, it's hard to just focus on a small area, you know, a part of the overall reaction. So if you look at certain chemical reactions or certain experiments, you will see, yeah, NAD plus will probably increase the production of other molecules, which may increase the inflammation. But there are overwhelming evidence to show that it is opposite. NAD level, decline of NAD level is related or is at least correlated with inflammation. So enhancing NAD level has been shown in many studies to suppress inflammation. So that's, you know, I think we have to count the number of evidence, right? You will always find some, you know, some reports, some studies to show a conflicting result. But you have to look at, you know, more references, I guess, literatures to see the ratio of the, you know, the opinion whether NAD plus is pro-inflammation or it's anti-inflammation. I guess that's my point. One or two studies may not change the, you know, the overwhelming evidence.
Yeah, if I may add to that, I look at the way it's benefited me, and for instance, my hand, I'll try and put it where I couldn't close my hand because of the arthritic inflammation that I had in my fingers.
Mhm.
And in about 6 months use of the NMN gene balance, I've actually regained 100% of my hand function and no pain. So we know that arthritis is an inflammation disease. So you know, we like Dr. Zen said, we can't base it on, you know, certain things that are being brought out in these studies to say that it's going to affect everybody that way. So each person is going to be on an individual basis. Now, just on the other side of that as well, we can't say that maybe somewhere along the line it doesn't or does cause certain things, but we don't know. And there again, you don't know if you don't try. So if we look at some of the negative reports that are out there and we base all of our decisions on the negative reports, then maybe we really didn't want to do this anyway. That's kind of the way I see it, because we're looking for no's rather than yeses. And I'm the type of person that I would rather see what it does for me. And I won't necessarily recommend something I don't believe in. And my goodness, I 100% believe in the NMN gene balance. And I know our research team has been wonderful in making sure that we have the right dosages, We don't need the extra dosages. I've seen so many different products out there that give you such a high dose of NMN that I can't see them being in the same purity level as ours, even though it may say it on their bottle. But why do you need so much to do the same thing that ours does? That's the way I see it. And I trust our products. I trust our science team, and I trust everybody I work with when it comes to this.
Great. Thank you so much. Somebody asked, can it help child with autism?
So we don't want to get into whether NMN can treat one problem or not. That's we
true.
can't really say.
Mhm.
You know, but there's no. I mean, I'm sorry to say this, but there's no evidence. So if you ask, will that work? As Don just mentioned, that it may work in someone, but not the other one. It's really hard to say. I don't know. I mean, I don't think there's any evidence, or even in the animal studies, that has the you know, conclusion. So
Okay. All right. Susan actually just mentioned in the chat, saying the answer to those who think increased NAD plus causes cancer. Okay. Thanks.
yeah,
for
so
your comment.
someone will always pick something to against, try to argue with you, right? So if you say this, you know, supplement or this, you know, compound may help to prevent cancer, there are always evidence to show, look, this study shows that this compound may actually cause cancer or increase certain factors that may lead to, you know, cancer. So there's always study like that. And study, honestly, I feel like study want to, you know, try to link their work with cancer because that's, you know, will attract attention. So they will, some studies will try to bring things that remotely related into their discussion. So I think we have to, unfortunately, we don't have clinical evidence like clinical trials, but we have to basically see the like animal studies and sometimes even consumer reported outcomes, like how other people use it and what other people feel. Because as I mentioned, that's also the consumer reported outcome is also an important information that can, to me, it's part of the you know, healthcare big data. You know, people's own experiment can contribute to our understanding of many health problems. So as a patient, as a user, as a consumer, we are also contributing to the knowledge. So I think that's also important.
Okay, thank you. There is another person asked, Dr. Zen, what are the studies on the impact of NMN on smokers?
So I would say for that, first, stop smoking. Second, take NMN. The reason being, it's very simple. You know, smoking causes cancer. That's almost certain. It will cause inflammation, for sure. It will damage your lung and make the lung, you know, cause fibrosis. All of these are part of the inflammatory process. So NMN can, to me, I truly believe that NMN can, you know, if not reverse, but at least slow down these processes that actually will damage the lung. So stop smoking and take NMN.
May I add something to that?
Sure.
Now, as far as my mother was a lifetime smoker, she did finally quit, you know, in her later years. But so I grew up as a secondhand smoker, but I can't stand it. I'm very highly allergic to the smoke. So first of all, I do agree. Quit smoking. That's your first step. Taking the NMN is going to help your immune system by boosting your NAD plus levels to continue cleansing out your body of the impurities that have been put in there for all these years of smoking. Now, as I said, I wasn't a smoker, but I did have lung issues. For many, many years, I was fighting different lung issues and problems. But within 2 weeks of using the NMN, my perpetual chronic cough was gone, period. And all my friends said, you know, you're not coughing anymore. And I, of course, told them why. And as I said, NMN is the only thing that I took. I stopped taking all my other supplements that I had spent lots of money on. I still actually have them in my cabinet. I've never gotten rid of them. I don't even open them anymore. But I'm taking only NMN now. But within 2 weeks, my cough was gone. And my lung function has improved so much that I can ride my bike. I get on my bike and I could probably ride out there to see you, Dr. Zen, and you're in Maryland, I think, right?
Yeah.
But,
Yes.
I mean, I feel I could do that. That's my whole thing there. So the NAD works as a cleanser in your system. The NMN boosts your NAD. So it's think of it, since I'm a car guy, think of it as your engine and fuel tank. You have to have fuel in your tank to make the engine run. So by keeping the NAD levels full through the NMN, you're keeping your body functioning like a well-tuned engine. And the more you do that, the more you're cleansing your lungs. It may take a while. If you've been a lifetime smoker, it may take a while, but just be consistent. Consistency is the most important thing. Don't take it for a little bit and then stop, and then take it again and then stop, because you're going to find it's not working like it should. Be consistent with it. If you want to take 2 capsules a day, take 2 capsules a day. If you want to take 1 capsule a day, at least take 1 capsule a day, but you're being consistent. And that is the only way you're going to really see the full benefit of what NMN can do for you. I saw beautiful results and things that I didn't even expect, but I was consistent. And to this day, I'm very consistent in taking my NMN.
That's true. That's true. Very true. Consistent is the key.
That's
Yes.
right.
Yeah. Thank you. There is another person asked, Dr. Zen, how do we know our level of NAD plus in our body? Any way or test that we can do to know our NAD plus level?
So there are companies offering this test, but to me, they are not very meaningful for the following reason. First, there's no standard to say, you know, you have to have this NAD level. Different people have different NAD level. So there's no standards. Even though you know your result, it won't help. Second thing is that NAD metabolism happens very quickly. So if you collect your blood and then you try to, you know, centrifuge it and collect the plasma, you know, get rid of the cells and measure the plasma NAD level, by the time you have the sample ready, NAD is gone because there are extracellular enzymes that consume NAD as well. The third thing is that what's really important is the intracellular level of NAD. What you can get from the peripheral blood is not in the cell, it's not in your liver, it's not in your muscle, it's in the blood. It's probably not even in the blood cell, it's probably in the plasma. So that's why I think it's not very beneficial. It won't give you a lot of information, you know, about your true intracellular NAD level. But scientists have developed many ways in their experiment. They actually test, like the clinical trial of done by the Washington University. They actually test the NAD level in the muscle, in the blood cell. Actually, not just the plasma. They have to do it very quickly. It has to be in a hospital. They actually put a needle in your muscle and take a piece of tissue and do it within like a minute or so. So there are places they offer to test your NAD level, but to me, that's not very meaningful.
Yeah,
I hope I address your.
Yeah, I agree with that. too, because it's the same as taking your blood sugar level. Your blood sugar level can change within minutes. You can eat something, it's going to be different. You can go without food, it's going to be different. So I mean, these types of things happen so quickly. You have to be on top of it, at all times. And as Dr. Zen said, the NAD plus does metabolize very quickly. So it's not something that most places will say, okay, you have this for an NAD plus level or blah, blah, blah. What they talk about is your immune system is strong. Now that they can see because of your blood levels, the different tests that you do run when you have your blood checked. They check for your liver enzymes, they check your kidney functions, they check your A1C levels. They can check all these things at that time. And that tells you how your immune system is working or how your body's working. And that to me is more important than trying to get an actual NAD plus level. They know NAD plus exists, and they know NMN and other boosters will raise your NAD levels, but you said the word, there's no actual standard as to what's a good NAD plus level or what have you, but we just know we need to keep it as high as we can, and that's how we do it through the NMN.
Okay, that's good to know. And somebody asked, say, does NMN help body to detox heavy metal, parasites, virus, etc.? So, Dr. Dan.
So there are different mechanisms, right? Heavy metal, it's probably bound to the some of the proteins in our body, and it's very hard to get rid of. I haven't seen any literature that shows that NMN help with expel heavy metals, parasite and virus. So virus, there are studies to show that the decline of NAD level is associated with virus infection. So because NAD level is low, your immune system is low, and you are likely to get virus infection. So for the virus infection, NMN may help. But for the other heavy metal, I'm not quite sure. Parasite, I'm not quite sure if NMN can help. There are probably a better treatment for heavy metal ingestion or parasite. They're probably more effective drug for parasite infection than NMN. So you probably, if you suspect you have parasite, you should consult doctors, and they can prescribe some, I guess, more effective medication.
Yes. Okay. Thank you. I think the last question right here.
Can I just say real quick, if you were to put into Google NMN and heavy metal detoxification, there are some articles that are written about that. So, I mean, we don't have time to get into it because I just did that to see if there is anything on it. I personally am a lover of study. So when I find things like this, I'll go in and I'll research it. Dr. Zen and I talked the other day, and we were talking about how when we're preparing for a seminar, all the different studies that we go through makes us sound like we're so smart because we learn so many different things when we're preparing for all this. And we have all the different researches that we come up with, and we really take a lot of time out of our schedules to prepare the most concise information to help you benefit the quickest from from what we have found. But there's so much information that we go through. We couldn't share it all with you. I mean, it would take days to really share this information. So my suggestion is go to Google, put in detoxification of heavy metals, or NMN and detoxification of heavy metals, and read some of these articles on that. And I will agree with what Dr. Zen was saying about the parasites. And the parasites, sometimes you have to kill the parasite before you can get it out of the body. So, you know, there may be a different avenue you need to take to get rid of the parasite that way, and then, you know, benefit from the other side of the NMN to help recuperate from whatever you had to go through. That's how I see it. Because parasites are a whole different avenue. I agree with Dr. Zen. There's nothing that I've seen at this point that's going to say NMN is going to kill the parasites. But we do know that it helps to cleanse the body through the NAD+ levels. So just don't be afraid to do a little research on that yourself. And maybe you could be teaching us the next time we're here too. You know, say, hey, I found this. And it was great. So,
that's
you know,
very good suggestion. Thank you.
yeah.
Okay, there's another person also last, other than repairing the DNA, are there evidence or peer reviews proving that the telomeres are lengthened?
So, I mean, there are studies on telomeres and the enzyme that, you know, increase the length of it. And someone, you know, I can't remember the name, but the scientist received a Nobel Prize for doing that. But in our body, our somatic cells, the telomere will decrease with aging. And the enzyme that in long telomere, I don't think it exists in somatic cells. It's probably in sperm or egg, you know, oocytes, the reproductive cells. So, and also in cancer cells, I believe the telomeres is in length. So I'm not sure. I'm not sure if lengthening telomere is a good idea. I mean, there's a lot of debate on this, because when you lengthen the telomere, it may cause cancer, at least in some experiment. So, so we are talking about stabilizing the telomere. So we don't want it to be shortened too quickly, because once it's shortened, the DNA will, you know, the cell will not be able to repair the DNA, and DNA damage will occur when telomeres, you know, disappeared. So we're talking about stabilizing telomere, not necessarily make it longer. There might be, I can't remember, there might be an article about stabilizing telomeres, probably in liver or in kidney. I can't remember exactly.
Okay.
Sorry, I probably will have to go back and do more study.
Okay.
Like Don mentioned, that there's so much to learn, and I will, you know, write down some of the questions, and that will be my homework today.
Okay, leave to
Yeah,
next
that's
time.
good.
All right. All right. Oh, wow. A lot more questions here. So we don't have much time left right now. There is a couple more questions here, right here. So that's the last one. Okay. Dr. Zhang, is there any medical equipment that can measure our NAD+ level in our body in the market now? Medical equipment, I think we probably don't have that medical equipment yet, right?
It's you know, in this biochemistry test, it's more about the method. Is you need not only the equipment, you need a reagent. You are testing some molecules level. There may be one, I'm not sure. But again, I'm not sure how useful is that information. You know, you go to the hospital, you go to the clinic, you ask your doctors, can you test my NAD+ level in our body, right? Depending on, as I mentioned, how long you can have the sample ready for testing. Do you need to ship it? Do you need to keep it cold? And also just testing, NAD in the blood doesn't say anything, because you want NAD to be inside your cell, your liver, your brain, in order to improve the symptoms of Alzheimer's disease. It has to go across the blood brain barrier to have its effect, right? So I'm not sure what the purpose of testing NAD plus.
Because he's saying that the NAD plus level is so important to human body. Yes,
Right,
I do
it is.
agree that, yeah.
But the testing, the way that we test it, it doesn't give us that information. You see what I mean? We want to see what's the NAD level in the cell. Well, you're withdrawing some blood, and it's in the blood, that will be metabolized quickly.
Mm-hmm. Yes. I hope this can answer your question, but this is kind of hard to answer that in the precise way. Okay, I think I missed another question here. Google iHealth, not much result coming out for this company. Why? Donna?
Well, yeah. Oh, thank you. No. I do have people that ask me about that all the time, and you have to understand that iHealth is a newer company, so there is not a lot of information out upon it right now. We've been working here in the United States to get certain accreditations that will prove who and what iHealth is. We have, for instance, right here, I just Googled it myself. We have iHealth Innovation Tech Corporation, Better Business Bureau profile. We have the A credit, or the A accreditation level for the BBB. And mind you, you don't get that if you're a fake company. If you're not doing what they say you're doing, they will not give you that accreditation. The BBB is very important here in the United States. And I know when I was first starting here, I was having a little difficulty with some people because of that. So when I talked to Herbert, I was able to get all that in line. We got our accreditation for the BBB. We have the certain certificates for the FDA to sell throughout the world. Those are very important as well. So, what do we really need to know about the company? We have so many people in the company now. We have maybe 80,000 people plus in the company. We're sending all over the world now. So the business is growing, and things will start coming out more and more as we go along. And I'm going to tell you right now, I was sitting in the office with 5 people when we first started. So there were 5 people there, and I was one of them. And now look at what we're at. So, and this was just within a short 2 years, as far as I'm concerned. So here we have pictures up here. We got our BBB. We have all of these certificates that we do have. The BBB would not give us anything as far as they're okay if we did not have all of these things in line. Their criteria is so strict. And especially here in the United States, they will not give you that accreditation if anything that we have showing here is a lie. So if that still bothers you, that you can't find all the information you want on a company, I don't know what to tell you. I mean, I can't twist your arm and make you believe in something that you want to have a question about. I just know that I am here in the United States. I just came today from the office. I just went to the new building today. Within a couple of months, we'll have our grand opening, most likely, of the new building. So I was able to take my tour of that today with Herbert. And I do have a picture proving I was there. But anyway, all those things are real. I mean, this is not a fake. You're always going to have somebody asking question. Well, I can't find this. I can't find that. Well, I don't know if it's real or not. Well, we can't please everybody. I'd like to, but unfortunately, if you still have questions, I really don't know what to tell you. I know it's real. I believe in the company, and I can find things on Google. If I really get in and research it, I find all sorts of information on the company. So it's just a matter of what are you really looking for? What about the company do you want to know?
Mhm.
I see all these things, and I know what it's like to need the Better Business Bureau on my side. I have a repair business still. I've had that since 1977, and I have a good rating with the Better Business Bureau as well. And believe me, if I didn't, I wouldn't have my business all those years. So you just have to understand that that's very important here in the United States. So look at what you have in front of you and understand we're a new upstart company. We're ground floor right now. So do you want to be a part of the ground floor of a $46 billion a year business and just supplements alone? That's really what this is. And we're not even talking about the skincare products. This is just the supplement side of it. So, if you're looking at it as a business, this is the business to get in, and iHealth is really the place to be at this point. Don't cut yourself short and say later down the line, oh, maybe I should have just stayed there, and look at all the information that's out there now, and I decided not to stay with it. So, right? I mean,
Yes.
am I wrong? Tell me.
Yeah, that's true. There is another challenging question for you, Donald, right here. So we are the only one company said our NMN is grade 1. Some persons not trust it, even we can find on PDR. They said grade 1 not really standard. How to prove it? So let's go to the PDR.net. You can find it over there, right?
It should be there in the PDR. Now that's something too that you can speak to your doctors about, and they can get more precise with that as well. But our grade 1 just shows that we do go an extra bit further to make sure that our purity level is higher. Now, just because we have the rating on there of a purity level, that is your minimum rating. We will never go below that. So when you think about it, our purity level can actually be much higher than what it is. And we just need to understand that grade 1 is just that one extra step. I've had people tell me the same thing. Oh, what does the grade 1 mean? It really doesn't mean anything because they can't find it. Okay, or what have you. We still know we have a purity level that is right up there at the top. There's things that we can nitpick on any avenue. You can always nitpick something. Why is why is this on there? Why is that on there? Well, we put it there because we have that rating. Okay. Grade 1 to some may not mean anything. Our purity level is one of the highest. The grade 1 just means we took that extra step to make sure we have it. So there again, I don't know how to answer that to anybody's satisfaction. It should be something you can discuss with your doctor, have them tell you what a medical grade 1 is. That means it's top of the line. They would know that.
Okay. Thank you very much, Don, for the advice and motivating talk, which inspire our level of belief and confidence in iHealth's NMN business. Hope hear from you, sharing with the plans and direction of our iHealth business. That's somebody wrote on the chat for you, Don. All right, and yeah, it's true, and I have the same thing, same thoughts. And also thanks, Donald. Thank you very much for your insight, advice, right? Insightful advice today. And thank you so much, Dr. Jen, for your very professional training today to let us know more about knowledge about the NMN and such great presentations. And we hope we have more and more presentation like this in the near future, so we all can share, we all can benefit from your knowledge. And thank you so much for everyone for your time and your joining today. And let's have have a great weekend together and continue success in iHealth business. Thank you so much. God bless everyone.
Thank you, everyone. Thank you, Don.
Thank you.
Melissa. Thank you,
Thank you.
everyone. Yep.
It's a
So
pleasure.
if we don't get a chance to answer your question, come back next time. So we'll get your question addressed. Can't promise that we have the answer you'd like to hear, but we'll do our best. So come back. Unfortunately, I think we're already online for an hour and 45 minutes.
Yes.
We hope to see you next time.
Yes. Thank you so much, everyone. Thank you. Thank you, Donald.
Oh, yeah, thank you. And thank you for all of your questions. They're all good. And you know, we do try to do our best to answer these things. We're not here to hide anything or what have you. We want everyone to be educated, and we get educated ourselves too. So we thank you for these questions. And once again, we can always learn more as we go along. So we look forward to it.
Thank
You guys are great.
Thank you.
So you're all
Thank
the
you
best.
for the wonderful questions.
Yes.
It make me study harder. So you know, I like to see the questions, and I will do more research. Hopefully, I can find some answer.
That's true. And for me too, I'm going to do a little bit more deeper on the grade 1 as well, because this isn't the first time I've actually had this asked to me, but you know, it's not for me, it's not an issue, but for some it is. So you know, we'll see if we can get a better, more concise answer for that. And I know we're going to be doing more of these meetings together. So
Yes.
you know, it'll keep getting better and better and better. Look forward to seeing it grow. We had quite a few here tonight, so that was nice.
Thank you so much, everyone. Everyone's so
Okay.
great. Wonderful. Thank you. See you
right.
next time.
Okay, bye-bye.
Bye.
Bye, everyone.
Bye-bye.